does our treatment include? This sounds a little bit, how can I say, theoretically. Immune stimulation. Immune stimulation is nothing else than building up the intestinal 80% of our immune system. Deacidification. Cancer patients are always hyperacid. This is a rule. Always hyperacid. And the cancer cell, they love this hyperacidity situation, the milieu. If you only get the person alkaline in his or her inner milieu, inner environment, the cancer gets less aggressive. Oxygenation. Cancer cells, they hate oxygen. They can't process oxygen. And there, with ozone or ionized oxygen, their cell walls, they get disturbed and fall apart. I come to studies afterwards. That's why oxygenation treatment, there are different methods, either oxygen breathing or IV oxygen, pure ionized oxygen, or the strongest, the ozone treatment, which fortifies the good cells because they can, with their mitochondria, they can utilize the oxygen, and the cancer cells, they cannot utilize oxygen. Did you know that cancer cells, they have a totally different metabolism than healthy cells? And this is why we use all the methods which support the healthy cells but can't support the cancer cells. We take this difference of cell metabolism. Cell membrane potentials. Did you know that the cancer cells, they don't have a cellular magnetic load? And this is why they can exchange and they can fermentate so easily. And the healthy cells, they have a very high electromagnetic load. This is the basis of why we do magnetic field treatment. But strong magnetic field treatment, pulsed magnetic field treatment, which is in the pulse, exactly in the pulse frequency, which the cancer cells don't support and they fall apart. Healthy cells, they do not fall apart by magnetic field treatment. All opposite, they even get fortified. This is why we do on our patients every day pulsed magnetic field. The next point, it's about endobiontic valencies. It's about the intestinal bacteria, which we have to upbuild. Did you know that we have more intestinal bacteria than we have human cells? We have more Lactobacillus bacteroides in our body. They are very small, that's why we don't see them so well. But in number, we have more of these bacteria cells than we have our cells. There is 100 bacteria bags sitting in here. So, yeah, it sounds a little bit strange, but we are skin bags with bacteria in. And we still believe that these bacteria, they are hurting us. No, they are serving us very much. They would detoxify, they would calm down the immune system, they would train the immune system, and they are the best detoxifiers in our system. And if we do antibiotic treatment, we destroy these bacteria. Honestly, did you ever think about why does the average age of cancer decrease? Why do we have nowadays 20 to 30 years old breast cancer patients? Why do we have ovarian cancer patients who get their ovarian cancer with 50, 40 years old? When I was a student, they were 80 years old. And why is the mortality rate increasing and not decreasing in cancer, even though we have all these super beautiful clinics and all the chemotherapies, but the rate of death in cancer increases. So there must be something else behind, and this is what we try to attack.